Hey, everybody, it is Christine Parakis, and we are back here with the Career Invincibility radio show. And I cannot tell you how excited, honored, thrilled I am to bring you my next guest, Dr. Michael Breuss, AKA the Sleep Doctor. He has credentials beyond anybody that you can imagine, multiple best-selling books. But more importantly, he's the guy who can tell you the exact perfect time to have sex, run a mile, eat a cheeseburger, ask your boss for a raise, and so much more. Dr. Breuss is the author of The Power Within, which is a #1 Amazon bestseller in time management and happiness. And who doesn't
Hey,
need more of
Christine.
that?
Hey,
So
Christine.
welcome, Michael. Thank you so much for
Hey,
joining us.
Christine.
Yes, yes,
You said the
yes.
title of the book wrong.
I
You said
did. The Power
the
of
power
When.
within, and it's the
I
power
did.
of
Oh
when.
my God, the power of when. I'm staring right at it. I'm sorry, everybody. It is the power of when, time management and happiness.
There we
Those
go.
are critical things for all of us, among other things, the Sleep Doctor's Diet Plan and Good Night, all top selling books. And Dr. Breuss is sought after on the Dr. Oz show. He's been on all the morning talk shows. He's been with Oprah. He's been the sleep expert for WebMD. I could go on and on, but I think we really want to hear from you. So let's talk to Dr. Breuss. How are you today?
Absolutely. Thanks for having me on the show. I'm excited to be here.
Oh, me too. So, what we'd like to talk about first and foremost with you, I get to the opportunity to interview wonderful people who've had great successes. And what happens when people learn about successful people like yourself is they think that's great for you. I could not do that. I can't be that. And you've been my mentor in getting my most recent book out, The Resilient Leader. And so I'd love for you to talk a bit about your journey to the successes you've had as the one of a very small number of psychologists on the American Board of Sleep Medicine as a diplomat. So please tell us a bit about your journey.
So my journey was serendipitous at best. So I really, so when I was in graduate school, getting my PhD in clinical psychology, I was interested in sports. I was interested in sports psychology, as a matter of fact. I was the guy that wanted to help athletes throw faster and run better and all these great things. And I was at a great school. I went to the University of Georgia. The #1 program for residency for sports psychology of all places, University of Mississippi Medical Center in Jackson, Mississippi.
Well, that's the first thing I thought of.
Right, I know, exactly. And so I was trying to get in, but to be honest with you, I went to a top 20 program, but it wasn't Harvard, it wasn't Princeton, it wasn't Yale. So I wasn't able to get in. However, they had a sleep specialty that you could do. And I had worked my way through graduate school, getting myself, making my living, as it were, in the electrophysiology department. So I'm the geeky guy who likes to take apart all the machines that measure signals that come from our bodies and put them back together and really try to understand that. And it turns out that sleep machines, the way we measure sleep in the laboratory, we use the exact same equipment. So I was perfectly trained already for these guys. So I sold myself as a sleep guy. By the way, never expecting ever to go into the sleep field, because I figured once I got there, I'd just transfer, right? Because just because you tell me I'm not going to be in your program doesn't mean I'm not going to be there. It just means that I'm going to be coming in from a different angle, whether you like it or not. And so I got there and I immediately put in for the transfer. And they said, we get it. You want to transfer, that's fine. But, you promised us and we need to fill the sleep track thing. So we want you to do the sleep thing first. And then, you can transfer and do whatever you want. And by the third day, Christine, I absolutely fell in love with clinical sleep medicine. And I knew this is where I was going to spend the rest of my career. I have a very unique position. I can help people in some cases almost instantly. It's certainly within 24 hours in many cases. When you're a clinical psychologist, you just don't see those types of treatment gains in patients very often. I mean, sometimes it can take weeks, months, even years with patients with depression or anxiety or things of that nature. So one of the things I've been really fortunate with is finding an area where I can identify things like sleep apnea, like narcolepsy, insomnia, and really make a difference in people's lives. And then, so I did that for a while. I got my first job in Decatur, Georgia, working for a pulmonary group. And I really spent a lot of time in sleep medicine. And so I was seeing 25, 30 patients a day. I was reading 10, 15 sleep studies a night. And I did that for about 5 or 6 years to really understand the medicine side of it. And then, to be honest with you, I got bored. I'm one of those guys that does get bored fairly quickly. And the medicine side was interesting enough. And even though I didn't go to medical school, passing the medical board gave me the opportunity to learn quite a bit of that medicine. What I discovered is that the business of sleep was interesting, and then the performance side of sleep was interesting. So I decided to kind of look into those two areas, and now I am a high performance sleep coach. So what I do is I work with athletes, I work with celebrities, I work with CEOs, I work with people like you. What we do is we really help them make their sleep better. And so quality of sleep turns out to be much more important than quantity. And I work very closely with people on slowly improving their quality of their sleep. And it's pretty miraculous. I mean, people, they're often pretty blown away. They're like, wait a second, all I have to do is these three things, and I have this much extra energy during the day. And I'm like, it's really not that tough. And so I hold them accountable. And to be fair, we do some advanced techniques and some interesting things like working with people's chronotypes. But at the end of the day, there's some very basic things that people can learn to sleep better, even right now.
Well, it's an amazing thing. You said to in a conversation we were having recently about when we teach people or help people get a good night's rest, we change lives. And you and I have had that experience where you put me on a course, and it was mind blowing, really, to suddenly go from, waking up in the middle of the night to sleeping consistently 7 or 8 hours in a row is, if nothing short of miraculous, and it really does change lives. And so, let's talk about it. And, it's become so vogue to talk about sleep. Right. And Arianna Huffington even consults with you about it in her book. And, so let's give our audience here something that they can do and actions that they can take to, maybe make a small change in their lives to make them better.
So if anybody gets one thing from our discussion today, just one thing, it's wake up at the same time every single day, every day. It turns out that your circadian consistency, that time of that you wake up, is sort of the anchor to your entire circadian health. Now, people might be saying circadian consistency, circadian health, what's this guy talking about, right? So let me tell you what I'm talking about. So what I'm talking about here is the fact that, in fact, we have two systems in our brain that function for sleep. One is called our sleep drive. This is the thing that makes us feel sleepy. And the other is called our circadian rhythm. This is what is a schedule, an internal schedule that tells our body when to go to bed. And so it turns out that if we don't go to bed when our body wants us to, it messes up a whole host of other things. And so once we learn what our chronotype is, and the good news is everybody can figure it out pretty quickly. You can just go to www.chronoquiz.com, and we can put that in the show notes if people didn't get that. It's chronoquiz.com to learn their chronotype. But what you learn from your chronotype is what time to wake up in the morning. So it turns out there are 4 different chronotypes. And by the way, everybody out there has heard of this chronotype thing before, but they might not have heard the word before. If you've ever been called an early bird or a night owl, these are chronotypes. So what I did was I changed the naming system, and instead of there being 3, there used to be early bird, what we called a hummingbird, which was somebody in the middle, and a night owl. I changed them to animals. And so we have a lion, which is an early person, a bear, which is somebody that's in the middle, a wolf, which is a night owl, and then a dolphin, which is an insomniac. And so I know this is getting complicated, but I'm going to simplify it really quickly. If you go to chronoquiz.com and you figure out what your chronotype is, it will tell you what time to wake up. If you can only do one thing, keep that consistent wake up time. The reason for that is that circadian consistency actually keeps all of your other hormones consistent as well. So what's interesting is if you wake up, let's say at 6:30 every single day, your body then knows exactly what to do. It knows when for the cortisol to fall. It knows when for the melatonin to shrink. It knows when for the adrenaline to increase. But if you wake up at 6 o'clock one day and 7:30 the next day and 6:45 the next day, your brain just doesn't know when to do that because it's on a set schedule. So if there's one thing you can do, it's wake up at the same time every single day.
So what is that? Does that have anything to do with when you go to sleep at night? Because I feel like, when I was getting up at 5 in the morning for the last handful of months through this pandemic and with my
Right.
practices. And so that was about an hour earlier than my consistent time. But I found that I needed to go to sleep earlier so I would feel better waking up at that extra hour earlier. What do you say
So
about that?
So here's what's interesting that's exactly correct. And what happens is people kind of find their own little way, if you will. So what I do is I set the wake up time and then I tell people, look, you can go to bed at whatever time you want, but you got to get out of bed at this particular time.
No matter how wrecked you feel,
Excuse me.
if you've gone to sleep at midnight and you have to wake up at 5 and you
Right.
feel bad,
Right.
is that recoverable?
It is recoverable. And what happens is people figure it out, right? And so 9 times out of 10, there is a lower level limit, right? And that lower level limit is 5 hours. So if I'm asking you to wake up at 6 a.m. every day, you really probably need to be asleep by 1 in order for you to have the minimum of 5 hours. To be clear, I am not telling everybody out there just to get 5 hours of sleep. But what I am saying is that there is a lower level limit where it becomes dangerous. And driving a car, having only had 5 hours of sleep, is not a safe thing. Your reaction time is slowed by almost a third. There's issues there. But again, you will self-adjust because you'll start to learn when you're getting tired. Now, the other thing is, and this is very interesting, is I have a lot of patients who go to bed too early. Now, you might be saying, what are you talking about, sleep doctor? You're the guy that's telling people when they're supposed to go to bed. In fact, what's so fascinating is that many people get in, especially people who have sleep problems, they get in bed early hoping to fall asleep. Quite honestly, all that does is piss off your brain. You lie there, you don't fall asleep, right? You cause all this autonomic arousal. And then guess what? You're not able to fall asleep. So really what I try to do is I try to find the 7 hours of time when I'm most likely to be asleep. So for me, I go to bed at midnight every single night, and I wake up exactly at between 6:12 and 6:17 for some strange reason every single morning. I
Wow.
can't tell you exactly why my body is that precise, but over the years of just falling asleep when I do, that seems to be what happens. And so I know it, I can work with it, and I know exactly what time I need to go to bed to do it. And I can do that, by the way, all over the world. And I function like I've had 0 coffee this morning. Right? I have tons of energy. I'm the sleep doctor, for God's sakes, and I'm sleeping 6 hours and 13 minutes, right? So,
Well, some people might think that wasn't enough, right? But
right.
it works for you.
And that's
And
the
it
point I'm trying to make is everybody's sleep need is individualized. Thank you for bringing that. Thank you for making that point more consistent. So 8 hours is a myth, Christine. Like that's something important. Like 8 hours is a general rule for people that is not accurate at all. I mean, again, I've been sleeping 6 hours and 15 minutes for the last 15, 20 years. I have plenty of energy. I mean, you and I, we hike together. I mean, like, you know
Yep,
who I am. I mean, this is
I
not
sure do.
right. It's not set in stone that everybody needs that time. Now, there are some other things that people can do that I think could be very, very helpful that are easy to remember. So step number 2 has to do with caffeine. So I always tell people don't realize it, but caffeine has a half-life of between 6 and 8 hours. A half-life, mind you. So I'm asking people, if you can, step number 2 is to stop caffeine by 2 p.m. Now, here's why. If you take 2 p.m. and then you fast forward by 8 hours, that's 10 o'clock. Most people, at least here in North America, have a tendency to start to go to bed somewhere between 10 and 11 o'clock at night. So this way, at least half of the caffeine is out of your system. Now, I know there's some people out there, and here's what they're thinking. Huh, sleep doctor. He doesn't know what he's talking about. I can go to bed. I can have a big old